Hello, I am Marwan Abourass. To really understand the seriousness of the pulp calcification problem, we should discuss it in terms of its effects on the anatomy and physiology of the dental pulp, specifically the dental pulp chamber. And this is the purpose of this video presentation. The cumulative effects of a long-standing, low-grade pulpal injury cause pulp calcification, PCC, a term which I would like to use because it really describes the pulp chamber calcification, the pulp canal calcification, and pulp calcification in generals. It encompasses the pulp stones, the canal obliteration, the denticles, the opacities we see in the pulp chamber. So this is the term I'm going to use as an abbreviation, PCC. What is it? It's a dystrophic degeneration of the dental pulp tissue. It's gradual, it's continuous. It may take years, 3 to 10 years been estimated. And clinically, it's asymptomatic. It's accompanied by progressive strangulation of very valuable, highly specialized pulp tissue, the odontoblasts, the undifferentiated mesenchymal cells, the stem cells, fibroblast, the cell-rich zone, the neurovascular plexus. All of these connective tissues will be replaced with globules, spheres, masses of calcium and other minerals. So it's actually mineralization. Calcification is mineralization of the dental pulp. And it's not depictable in the early stages. It's been stated that we see only about 15% of it. It is asymptomatic. However, when bacteria gets involved, when we have coronal leakage, when we have substandard restorative treatment, open margins, etc., bacteria gets involved in the process. And now here you have a calcifying pulp, already injured pulp, and now has to be additionally diseased with pulpitis, with pulp necrosis, with apical periodontitis. Clinically, I like to differentiate between two types of calcification or PCC. The pulp chamber, which is of interest to the prosthodontist, restorative dentist, general practitioners, because it caused the failure of restorative treatment, the failure of prosthodontic treatment, the failure of aesthetic dentistry. It creates a need for endodontic treatment after prosthodontic and restorative treatment. And then you have the calcification of the canal, PCC canal, which is of interest to the endodontist and the performer of endodontic treatment in general. Because this is the serious type. This is the one that impedes, complicates, or even prevent altogether standard endodontic treatment. It creates ledges, transportations of the canal, creating false canals, breakage of instruments, and most important, the short fills. Short fillings in endodontics is responsible for 52% failure of endodontic treatment. So we don't want to take PCC as a light issue. It has not been emphasized, sadly, in the dental curriculum. And that is the purpose of this presentation. We're going to have two presentations. The first one towards better understanding of the pulp chamber and relationship to calcification. That's a slide presentation. And the second presentation, how to manage, how to diagnose posterior teeth and prevent PCC. Thank you for listening, and let's go to slides.